the heart doesn't have time to receive the blood and also pumps to the lower chamber, which is the main pumping chamber of the heart. When the heart doesn't receive blood well, what could happen is the patient might have symptoms of feeling tired, they could have shortness of breath, and they could have CHF, what we call congestive heart failure. Atrial fibrillation, as the word implies, atrial means the upper chamber, fibrillate means the heart is beating very fast and irregularly. A patient who has atrial fibrillation, they might not have symptoms. That becomes a silent killer, so to speak, because when the heart goes into atrial fibrillation, the risk of stroke is significantly higher. Atrial fibrillation is one of the main factors for causing a stroke. We are really targeting treating atrial fibrillation. In considering stroke, we would consider most of them are what we call ischemic stroke. And out of the ischemic stroke, there are two main categories, what we call thrombotic stroke and embolic stroke. Thrombotic stroke, that means a plaque is formed in the artery supplying the brain, and when a part of that plaque rupture, then the thrombus can form, very similar to how a heart attack occurs when the thrombus blocks the artery, not enough oxygen, not enough blood going to the brain, and that can cause a stroke. And the second category is what I call embolic stroke, meaning that there is a thrombus forming in different parts of the body, and the most common place is from the heart. So the heart can form a thrombus, throws it to your brain, it can cause a stroke. And atrial fibrillation is the main problem that can cause a thrombus to form in the heart. Because of atrial fibrillation, the upper chamber is beating very fast and irregularly. So during that time, the blood doesn't circulate around nicely, so clots can form. And again, if a part of the clot breaks off, goes to the brain, and can cause a stroke. Depending on the other risk factors, atrial fibrillation increases the risk of stroke by about 2 or 3 folds.